On today's episode, we're going to talk about neurodivergent grief.
Yeah, we're going to talk about some clinical stuff, some subjective, something to ponder on.
So listen in.
Let's talk about death, baby. Let's talk about grief and mourning. Is it argumental or existential? What's it mean to me? Let's talk about death.
Hi, I'm Benny Cabal, and I'm a funeral professional.
And I'm Nicholas Cabal, a psychologist.
Hey, Nick, let's talk about death.
Let's do it.
All right, Doc. Today we're going to talk about neurodivergent grief. Everything that encompasses that. How this kind of got brought up. I had an opportunity to do a little bit of a talk. I got up there and did my own talk there on directing suicidality. So I thought that was a really cool topic. And somebody brought up in that conversation, it had nothing to do with my presentation, it had to do with another one about neurodivergent grief. And I was like, you know what? Doc and I have not talked about that. So let's delve into that.
I would say the big ones, the big A word, right? Autism is a big version of this.
And that's what they were talking about. The speaker was really getting into people on the spectrum, which I know now is part Asperger's, right? Asperger's is now part of...
Asperger's does not exist anymore as a diagnosis,
Okay.
which is unfortunate, in my opinion, but I also understand why they did it.
So we're going to talk about that. And why I'm going to talk about that is because obviously in the funeral home, I have a lot of neurodivergent people come in. Even in our family, we have some neurodivergency. So my big thing is like, I wanted to know the big differences when it comes to grief, right? Because non-neurodivergent people struggle with grief.
Yeah.
So therefore, how does that look on the perspective of somebody that is neurodivergent? So I did a little research here, and there was a lot of things that came up. But the big one that kept coming up is disenfranchised grief, which we did an episode on. So we can, if you don't know what disenfranchised grief is, please go back to that episode.
Well, just for the ones that haven't, it's grief that is not allowed to be explored or explained. So big examples of this would be like homicide or suicide or things that most people cringe about talking about. And therefore, it makes the grief process a lot more challenging and difficult because the people that are grieving can't talk about it. That's a disenfranchised grief. Continue, Ben.
The other ones that came up was the double taboo of not only death, which we talk about more than enough on here, but then adding disability to that. So adding, how do you not only yourself deal with grief when you're also dealing with your disability, but then trying to talk about it in an open in the public where they don't even understand your disability. Therefore, how are they going to understand your grief on top of disability? And something that was really cool to me, and I want to get him on the show eventually, is I found out that one of the funeral professionals, which I'm sure there's more than one. I'm sure there's a lot more than one. But I'm saying has specifically came out and said, not only am I on the spectrum, but I'm a funeral professional. And I think that's absolutely wonderful because I can just imagine all the families that individual can really empathize with, especially when they have a child or somebody in their family that's dealing with neurodivergency. The biggest thing that kept coming up was either disenfranchised grief or change. The idea that, especially with the people on the spectrum, and stop me, Doc, if I'm saying this wrong, but they have been trained to be on schedules and to have a certain amount of consistency, right?
Structure.
Good. That's the word I'm looking for. So obviously death is a complete brick to the wall, or a sledgehammer to the wall when it comes to having something structured every day, right? The same person is going to feed you the food. The same person is going to come in and have a conversation with you at a certain time. You're going to do this from 9 to 4, et cetera, et cetera. So when you have somebody, especially that's somebody that's a staple in your life, die, they're not there anymore. So therefore, changes have to be made. And when you're struggling with knowing that you struggle with change, the empathy of that Doc, is incredible to me, because I know with my own grief and loss how impactful that can be. I can't imagine the extra. But then also there's a part of me that's like, okay, are they looking at it from a different perspective than we are? This is just how I grieve. You grieve differently, and maybe we grieve harder in certain ways that they don't grieve, or vice versa, right? Because we've talked about this. Everybody grieves differently, so that's another caveat to add to this market here. But the big thing I wanted to talk about is, for you in clinical, have you ever had a patient that has been neurodivergent that has talked about grief? And do you find certain commonalities when it comes to what they talk about?
So if we're talking about neurodivergent people, the problem I'm going to have answering that question is it's a spectrum. So like depending on where they're at, what their understanding is, what their intelligence capabilities are, because if we're talking about someone who's nonverbal, if we're talking about someone who literally cannot explain how they feel because they are so disconnected from what feelings are. And a lot of neurodivergent people, it sounds pretty basic, but like it's about helping them be able to explore and label what the feeling is, if they even have it, even if they, because here's the other thing, right? You talked about what was it? Change. You talked about change. You talked about
disenfranchised
grief and
change, and the taboo of death and disability.
Okay, so let's kind of dissect those a little bit. So let's start with change, right? You're right. You're absolutely right. A lot of autistic people or neurodivergent people will tend to be very, very scheduled, and change for normal humans, if we're going to put normal or the average person, right? Change is not good. We do not do, as humans, we do not do well with change. Change brings a lot of questions, a lot of concerns, and a lot of worries. And in an anxiety-ridden world that we live in, change is terrible, terrifying. So here's the reality. So change, absolutely. But here's the other thing. Depending on their intellect, right, do they understand that there's been a change? Maybe they don't even comprehend that there's a change, right? As long as someone still gives them food, or someone still makes sure that they go to the bathroom, right? Maybe it doesn't matter who that person is, depending on the person. Now, most average person, even some people like we would call Asperger's or high functioning neurodivergent people, yes, they are going to recognize there is a difference. There is a change. There is a loss, right? Something was there and now it is gone. So again, a lot of times when I'm dealing with neurodivergent people, it's more about labeling, exploring, and getting them to understand that they have their own feelings. It's not necessarily a lot of the time, how they deal with the public. It's more of how they deal with themselves. Because if you can get them to acknowledge that their pain and acknowledge where it's coming from and what it looks like and what it feels like and where they feel it in their body, then once they recognize that, then we can work on how do we deal with the public, right? Because it's more important for me to work inside first than out, and outside second. Because obviously they have to live in the world, so you have to help them navigate that. But more importantly, if they don't even know what they're feeling, it's going to be hard for them to navigate when they're feeling it, if that makes sense. And then the other thing was disenfranchised grief. I absolutely agree with that. I think that because we are such a death avoidance society to begin with, the idea of educating oneself to be able to talk to a neurodivergent person about grief seems like 3 steps ahead. Like most people are going to barely talk about death. So for them to go get educated on how to talk to a neurodivergent about death, they're probably not going to do. So it makes sense why that's a disenfranchised group, right? And then the other one was
the taboo of death and death.
Yeah, and I mean, let's be honest. Like I said, like death in itself is taboo. So of course the situation in itself is going to be that way. But I'm going to throw something back at you, Ben, because one of the my own experiences in therapy was interesting. It wasn't actually dealing with the neurodivergent person. It was dealing with the parents of the neurodivergent person who died, and being the caretaker to that neurodivergent person their whole lives, and then losing that person, and how they had to understand them, and how they had to do all this work of exploring and educating themselves on what it looks like to have an autistic child, right? And how to deal with that, and how to help him navigate his environment and all this stuff, and then losing him, right? It was a very interesting work, because a lot of it was exploring how, their whole lives work was based on taking care of their son who was autistic. So it was really, it's fascinating, because that's another topic we don't really talk about, is the caregivers to these neurodivergent people when something like that happens.
Well, especially because, and we've talked about this, Doc, that brings up meaning, right? Because that's a whole
Yep.
the existential part of that, where they've spent their whole lives caretaking for this individual.
Yep.
Now they're gone.
Yep.
Now, how do they go back into?
No, and it's fascinating, because a lot of the issue that we were working on is how they can be happily married for their retirement, because they're like, we both can't. We look at each other and we just see
We
him.
don't recognize,
We just
yeah.
see him.
Yeah.
And that was all of our, every day I would take him here and do this and do that every day. Because again, it's when neurodivergent, it's scheduled. So every morning, mom would go in there at a certain time and wake them up and change them and make sure that they ate. Because that's the other thing with a lot of neurodivergent, it's the same breakfast every day.
Well,
every day.
This is what's interesting. So let's flip the lens on those parents, right?
Yeah.
Is that disenfranchised grief?
Absolutely. Well, absolutely. People don't understand, because I think some people, and I don't mean this as they're being malice, but I think some people look at it as like, you don't have to deal with that anymore.
You will never understand that situation until you actually have a neurodivergent child.
Correct.
Right? So that the big thing, so what I was trying to say was, is that disenfranchised grief for those parents?
Absolutely. Like, there's a complex situation here. And I hate saying this, but I think it's the beauty of any therapist you ever talk to. It depends. It depends on the situation.
It is. And it also depends on where the spectrum they're at too. And you're absolutely right there, because if they can't quite grasp what actually is going on. But I'll be honest with you, with the neurodivergent, especially kids that parents bring into the funeral home, what I find very interesting is they are a breath of fresh air.
Yeah,
to that room.
They normally will bring
They
a
want to
happiness
hug.
with them.
They want to hug everything. They want to talk to you about their wrestling or their baseball cards, and it's really unique, because they'll know, and they know, and it reminds me a lot of the time. It reminds me of children. It reminds me of children coming in, because it's very concrete. That's Uncle Louie or he'll say, they'll come up and they'll say to me, "That's Uncle Louie in the casket. Now let me talk to you about WWF."
And he died in his bed.
Yes,
And
yes.
You're like, yes, you're right. You did.
And that was his favorite shirt he liked to wear. And then moving on to, now let's talk about baseball cards.
Right. And that's the thing. It's not necessarily like, if we're going to say the average person of avoiding talking about the death, they just don't need to. They don't. It's not. It sounds so weird, but it's like,
it's a thought of, are they actually processing the death?
it depends. And
better, in quotation, better,
right?
Quotation, because I know you understand what I'm saying. Better to you all. I mean, are they more
Healthily,
in a healthy manner, going through their grief process and then moving on?
Well, and that's
and I don't mean moving on like that's important.
That's the question, depending on who you're talking to. Because if you're talking about healthy, is healthy going through all the stages and acknowledging the death and working through that grief, or is it healthy for a neurodivergent person just to acknowledge that it happened?
Clinical side, is that huge that they're doing it?
Again, it depends. It depends on where they fall on the spectrum.
So this is probably an episode that we could do in 12 different ways.
I'm going to say this too. I've met some very nonverbal neurodivergent people that are super intelligent. They just don't talk. They don't tell you what they're thinking. But if you ask them to write it down or to point or to, they communicate in other ways through music or whatever. But like, they literally, that they're processing what's going on. They just can't verbalize that.
That's I mean, it's really interesting. Something I wanted to bring up too when I was doing my research here. One of the big things to help neurodivergent individuals with grief and loss is narration and storytelling. So in the clinical side, this is, tell me about your uncle. Is this like, how would you describe that? Is this like, if you get them talking about their uncle and then realizing that their uncle's gone, that helps them process death?
Or maybe it's me creating maybe a fake or real story of my own subjective experience and asking them if they have any similarities. And then if they do, then it's helping them understand that, oh, that sounds a lot like anger. That sounds like you were very angry, because that's what I felt.
You're
right?
using yourself as an example
Sure.
to show.
And again, it depends on, I sometimes it's about letting. Here's the other thing is, like, some neurodivergent people will talk about themselves story wise.
I get it, like a third person.
Yeah, like,
Okay.
and again, as a clinician doing this is for years and working with neurodivergent people, you start to be able to kind of like read between the lines, right? And I would imagine there's things that I maybe haven't even caught, right? Because again, when you're working with neurodivergent people, and me having ADHD,
No, there you
so
go.
like the other thing is like I might get distracted by a part of the neurodivergency and not look at the body language, or not. So again, this is where I'm saying I don't think it's harder. I think it's just more complex. You have to be able to kind of dissect, if you will. Where is this person at? Is this person actually understanding what I'm saying, or is this person just nodding because they learned at a very young age that that's what they're supposed to do?
Before we go in the Q&As, as a clinician, for somebody who isn't a clinician,
Sure.
how do we help someone with neurodivergency, give them advice or help them with their grief?
Try to understand them. Try to
Okay.
understand where they're at. And again, this goes a lot to, I find, with males in general. Us males have been programmed to be problem solvers, to be fixers. And I think with a lot of grief, it's not about fixing it.
Well, we can't fix grief.
It's about shutting up and listening, and really listening, not just yeah, like some of us do with our wives when they're asking a lot of things that day, but like more like active listening, trying to understand, trying to empathize, trying to literally feel what that person is feeling in the room. If you can get that deep with someone, right? It's not easy. And I think, again, it becomes more complex when you're dealing with a neurodivergent person, because they're, the normal ways people communicate, that was in air quotes, the normal ways people communicate may not be happening in the room. Like I said, if you're dealing with a nonverbal person, they're not going to actually vocalize what they're feeling. You got to see it on them. Oh, I see you squeeze your fist. Like, are you angry? Are what's going on? Or I seen you tense up. Like, are you afraid right now when we're talking
You're
about
sweating. Are you anxious? Are you
right?
nervous?
And again, maybe they nod and say no, and that's just they were hot in the room or whatever, or startled by a noise or whatever. But like, or they might not even be able to communicate that much.
Right.
So again, it's very complex, and this is why in my field in psychology, right? That's why there's a lot of specialized autistic therapists,
Right.
because that's what they're learning. They're learning all of this. And I would imagine if you're an autism therapist out there, you're probably, nodding or shaking your head right now, like, yeah, he needs to do more research and learn more about this. But like, I think this is a great discussion, because I think there is a lot of, what do we do? How do we deal with it? Do we take them to the funeral home? Do they even actually acknowledge? And my thing would be, it's, just like almost like a child, like, why would you hide that from them?
Yeah, absolutely.
If this was an important part in their life, maybe they don't understand why they're there, but at least they get to see that person one more time.
Well, it's a huge discussion, because especially if like we've been pushing, like, educating high schoolers and grade schoolers on death and grief, you have to take that in consideration, because you're going to have neurodivergent students. And then the other question I have, and I'm sure I know your answer, but it would be probably really cool to have a neurodivergent psychologist specializing in neurodivergency.
It would absolutely be amazing. I think that one of the, and again, I'm not trying to put them all in the same box when it comes to autism
very,
and
very
stuff.
different spectrum.
But one of the main, I guess, disconnects with a lot of autistic people is empathy. It's really hard for them to understand, because they have a hard time understanding their own emotions. So to take it the next step to understand someone else's is even way more complex. So I would imagine it would have to be a very high functioning, if we're talking about autism. But yeah, I think, again, I think they would be great for certain, if you know what, I was thinking about this the other day. I think that there is personalities and maybe even neurodivergencies that would make a therapist really good at being like DBT, dialectical behavioral therapy, is a very textbook therapy. You do this, you do this, you do
in
this
order.
you do this.
You don't stray from the path.
And again, as a humanistic, I'm a very humanistic existential therapist. So like, to me, that seems restricting. That seems like, like I feel like you're missing out on the bigger picture. Don't get me wrong. Obviously DBT has been found to be very effective, especially with
right, and that's not necessarily saying you can't use it and then stray off and come back to it.
But I think that it's really made to be that way. You're supposed to follow it that way, and I think someone who is really, regimented and very by the book would love that kind of therapy, because there is no divergency. There is literally this is it. This is what this is what I do, and again, maybe being able to not completely empathize with the person might be really beneficial, because then they can just do their job.
Absolutely. And before we get into the Q&As, if you are, if you have any questions or thoughts, or maybe you are a neurodivergent funeral professional or death professional or psychologist or psychiatrist or anything, and you want to chime in, please write us. We would love your thoughts on this. But Doc, it's time
for the Q and the A. You got that Q
and A,
and I got that A.
Q&A, everyone loves that Q&A.
Q&A, Doc. Are we ready?
Q and the A.
Okay, hold on here, baby. Pulling it up again. I'm getting slow tonight on these. All right, here we go, Doc. Grief comes in waves. On Sunday, it will be 2 months since I lost my brother, my best friend, and all in all, my favorite person on this earth. He will be forever 25, and I will forever be heartbroken. Wow. The pain is like nothing I have experienced. It is so unbearable. The grief really comes in waves. Some days I manage to be a bit more productive. There are days when I can't even cry. And then all of a sudden, the grief waves come, and I can't stop crying. I can't function. I can't eat. I can't get out of bed. The truth is, I still can't believe that I lost him. My brain cannot process his loss. We were together for 25 years. I was his role model, his big sis, his very best friend. I feel guilt. I feel anger. I just cannot process this loss. Every time I close my eyes, I see him smiling at me. And the thought that I will never see his smile again tears me apart. It gets harder with every passing day because I see the world around me, the people, life continues. But not for me. Do you have any advice for me?
I think that's a statistically average traumatic grief experience. And I don't mean to put it in a box, and I don't mean to make you feel lessen it. But I think that sometimes when we're talking about trauma like that, and this is trauma, this is absolutely a disenfranchised traumatic loss. And what I mean by disenfranchised is that person in your life, nobody's going to ever understand how close you were to them. So if the expectation, maybe it's changing the expectation of people understanding that, because they didn't have that bond with him. So I think this is something that I've been kind of like swirling around in my brain lately, is that, I always tell people, people are going to do the dumbest poop. I was going to say the S word.
You even did the sound and then you stopped it. That's great.
Well, anyways, I'm working on my language too.
Your vulgarity. Good for you.
Sailor talk. But anyways, so I guess what I'm trying to say here is that The love that you had for your brother is beautiful. It's amazing. And it's stronger than probably most people will ever have with any human being. So for other people to understand that is almost incomprehensible to most people. And I mean that in the most, again, I always say death is beautiful, most beautiful way, because most people do not have a connection with a human being that replicates what you're going through. And that's why it's so challenging and so hard. With that being said, obviously I don't have a time frame here. You didn't present us with how long this has been, what happened, the whole story. But what I will say to you is, again, you're saying that you're having a hard time sleeping. Yeah, you got to get your sleep hygiene in check. The eating is normal when it comes to grief, and it's not eating is normal when it comes to grief, and it absolutely becomes normal in depression. So my thing would be to find someone, again, a group or a therapist or someone that you trust and that you feel safe with, that you can talk about this, because what you're experiencing is what a lot of grieving people experience after the first 6 months of a death. After the first 6 months, it's when the cards stop, the call stop, the casserole stop showing up at your house. That is when it becomes the most isolating, lonely part of the grief, is because everybody does seem around you like they're moving on. Some of it is societal, because we don't give time off. We don't give the adequate space nor the communication to deal with grief, because we are such a grief terrified society. So find someone that you can talk this through, and if you don't have that, start journaling. I'm not personally a big fan of journaling, just because I suck at writing, and I judge myself for that, so it becomes actually detrimental when I journal. But again, find some way of getting it out, whether it is writing, like if you're a musician, write some songs about it. If you're an artist, do some paintings. If you're none of those, just find some outlet, whether that is getting a punching bag when you're feeling this and go downstairs and give it a wallop. You like that? Wallop.
Love it.
But yeah, that I don't want to get too long-winded here, but like, just know that you're not alone. I know it probably feels like you're alone. But there's a lot of people that are suffering from a traumatic loss of someone that close. And that, I want to say this, to give you the straight S word, that sucks.
You know, the couple things that come to my mind, Doc. First of all, it hits home because Doc and I both have two children, and the oldest one is a girl, and the youngest one is a boy. And my heart hurts because I can't imagine.
I always say this, I don't want to imagine.
I don't want to imagine, because the thing is like, I have this view in my head that they are going to be thick as thieves for the rest of their lives, just like me and my three other brothers are. And the other thing that my heart hurts is, I'm 36 years old. I'm the youngest of the Capals, and I have had 36 years with all of my brothers. And I can't imagine losing one of those days with any of them. So my heart goes out to you. And there's also the older sibling problem too, where you feel like you have to be the one that protects your younger sibling. And especially it's the whole mom with sons and dad with daughters. There's a weird connection between when your sibling is the opposite sex too. And my heart goes out to you, and anybody who has lost a sibling, it's my heart.
Last thing I want to say is thank you for sharing your experience, because it does really reset priorities for me when I hear stories like that. And it makes me kind of take a step back and take inventory of, am I taking the adequate time of acknowledging and being humble for having a close relationship with my siblings? And am I taking the right time to be as present in those relationships as I should be. So thank you for sharing that loss, because I think that loss can also open up eyes to some of these listeners out there that maybe are struggling with a relationship with their brother or sister or sibling or parent. You never know. You never know.
And with that, we are going to close up shop. As always, thank you so much for listening. If you have any thoughts on neurodivergent grief or just anything that we talked about tonight, please write us at letstalkaboutdeathpod@gmail.com. Share us out there, like us, review us. And specifically, if anybody is dealing with grief or loss, or if anybody you know is neurodivergent that would really get into this, or maybe is a parent of somebody who is neurodivergent, please send this episode out. And as always, Dr. Nicholas, if you are not talking about death,
Then you are not living. Thanks a lot.